Good afternoon, ladies and gentlemen, and welcome to the Ask the Expert Show on 610 AM Sports in Philadelphia. I'm your host, Maurice Goodman, and today on the Ask the Expert Show, we will be speaking with the folks at the Art of Pain Management and Regenerative Medicine, and that is with me, Dr. Gerard Teller and Dr. Michael Skina. They're on the show here with us to speak about stem cell therapy and pain management. Welcome to the show, gentlemen. How are you doing today?
Well, thank you for having us.
Very well, thank you.
Very good. Well, tell us a bit about your practice and how the Art of Pain Management and Regenerative Medicine works.
We're located in the Upper Darby, Havertown area is one location, and Northeast Philadelphia, around the Northeast Philadelphia airport. And we've been practicing interventional pain management for the last 10 years together. We have a multi-modality, a multidisciplinary approach. Where Dr. Skina here, my partner, is a vascular and trauma surgeon by trade, and I'm a chiropractor and a physiotherapist by trade. And for the last 10 years, we've been dealing mostly with chronic pain, mostly referrals from other physicians, chiropractors, physical therapy clinics, post-spine surgery patients, people that have been in the medical sort of model for many years and, are in a lot of pain. We do mostly spine injections, shoulder, hips, knees.
Really?
We have a yoga program, a nutrition program, a swimming program, and we try to approach a patient's pain from many facets. About 2 years ago, we implemented stem cell therapy in our office. We use a wide variety of protein-enriched plasma, PRP, stem cells, exosomes, ozone therapy. So we try to take each patient as an individual and turn them into, reducing their pain.
There is an issue, a considerable amount of pain in our society in terms of activity, those sort of things that are moving pain to the point where that sort of thing of stem cell therapy and pain management has come to the fore, where you have a business that can be that large and move along?
Yeah, the stem cell therapy, as we've seen over the last couple years, is regenerating tissue, is decreasing inflammatory responses in the body, and these patients' pain levels, especially in our office, has been reduced by up to 70% on average. With stem cell and regenerative medicine techniques.
Interesting.
We pursue a multimodality approach to the treatment of patients with chronic pain. Our modalities include meditation, exercise, namely yoga, diet, weight loss, and injections. The injections that we do have traditionally been with a local anesthetic, called bupivacaine, which is fundamentally a long-acting lidocaine, and a cortisone medicine. There are several of them that are available. They're all similar. The cortisone medicine reduces inflammation and swelling. This treatment really does nothing to treat the underlying condition. This treatment reduces pain, but it doesn't do anything to improve the underlying arthritis. With stem cell therapy, we now have an opportunity to actually improve our patient's condition and get them their life back. Stem cell therapy relies on the body's ability to heal itself. So let's start with what a stem cell is. When we're first conceived, we have a sperm combining with an egg, and we have a single cell. That eventually becomes our entire body. So this cell is what we call pluripotent. It has the ability to become every tissue type, every organ in the body. These cells exist in our own bodies as adults. They're fewer in number, but they are there. The sources of the stem cells are bone marrow. They are naturally occurring in fat along the outer lining of capillaries, blood vessels in the fat. And they're also commercially available from umbilical cord blood, amniotic fluid. So what we do is instead of injecting the local anesthetic and cortisone into the area that we're treating, let's say a knee joint whose cartilage has deteriorated, we now inject stem cells, which actually regrows tissue.
Wow.
And the results are really dramatic, and patients are getting their lives back.
And that's fascinating because there's been over the years a bit of controversy regarding stem cells, types of stem cells, various strains of stem cells, but you found in your space stem cells that can be used, that manages whatever controversy issues with ethics and so on and so forth in that space. I know stem cells have been quite a bit of a dance.
There's many different ways to harvest and administer stem cells now. It started many years ago with bone marrow, and over the years we found that harvesting bone marrow is very painful, and there's a risk of infection. And we don't know how many stem cells we're actually getting after we harvest the bone marrow before we re-inject it. Plus, how old are you, Maurice?
In my 50s, 54 to be exact.
So you have a 54-year-old stem cell harvested from bone marrow. So then there's adipose tissue, similar situation. It's sort of like a liposuction that we can do and then harvest the stem cell from the adipose tissue. Again, we don't exactly know how many we're getting. There's a process about manipulating a stem cell, which the FDA doesn't really like us to do in our office. So we found it safer to purchase ethical stem cells from natural deliveries of babies, which is placental tissue, amniotic tissue, and umbilical cord blood through FDA-approved laboratories. So we know what we're getting. It's safer. They're stronger. They're day one. They're baby stem cells, and there's even now something called an exosome, which Dr. Skeen is going to talk about a little bit, which is something that's coming up in the next couple months. You're going to hear more and more about it in the mainstream media. And we've been utilizing it now for about a year, and it seems to be even more potent and better results using an exosome.
Doctors were originally using stem cells that were injected into joints for stem cell therapy.
Okay.
It was thought that these stem cells were actually multiplying and dividing and laying down new tissue. In the case of the knee example that I gave, laying down new cartilage. Research that has been done over the last few years has, primarily in animals, has led to the conclusion that these stem cells that you inject are not actually multiplying, dividing, and laying down new tissue. What's actually happening is these stem cells are releasing chemicals, so-called chemotactic factors and cytokines. The chemotactic factors, a fancy name for a chemical that attracts other cells. The cytokine is a fancy name for a cell that alters the function of other cells. So what's actually happening is the stem cells are releasing chemicals that are causing an inflammatory reaction that actually results in healing. It's attracting your body's own stem cells to the area and the various chemicals that are needed to lay down new tissue, grow new cells, and actually do their work. So the exosomes are actually produced in a laboratory that is growing a placental culture. And they harvest the exosomes from the placental stem cells. The exosomes are actually the product of the stem cell. When the so-called exosome is in the cell, it's actually called a vesicle.
Okay.
The exosome is nothing more than this vesicle that was inside the cell but is now outside of the cell. So it's called an extracellular or outside of the cell vesicle. And scientists have given that product the name exosome. So we're now able to administer a concentrated solution of what these stem cells would release into the joint. And we're actually seeing far better results than we saw with injecting stem cells. Another advantage of injecting exosomes is that there's no DNA in the exosome. And so there's no transmission of genetic material per se from the person, the tissue that the exosomes were harvested from, to the person that we're giving them to. So that's another advantage.
Indeed. That's greatly appreciated. I see that it's time for us to take a break. Ladies and gentlemen, you are listening to Dr. Michael Skeena and Dr. Gerard Teller, who are the principals at Art of Pain Management and Regenerative Medicine. And you're listening to them here on the Ask the Experts radio show, live on 610 AM in Philadelphia.
Stop dealing with chronic pain and illness of the neck, low back, shoulders, hips, or knees in the Philadelphia area. Would you like to get your life back? At the Art of Pain Management and Regenerative Medicine, the doctors will work with your body to help relieve pain in your muscles and joints so that you can increase your mobility, sleep better, and enjoy your days more. They work by using a variety of invasive and non-invasive treatments and techniques to help manage pain and chronic illness. Tradition, Western medicine, as well as yoga, diet, nutrition, weight loss, and stem cells are implemented to customize your recovery from chronic illness. At the Art of Pain Management and Regenerative Medicine, their aim is to personalize each plan to best serve their clients' needs. This individualized care is backed up by more than 50 years of combined experience and individualized attention at each appointment. If you are near Philadelphia or Upper Darby, Pennsylvania, the offices of the Art of Pain Management and Regenerative Medicine may be your key to health and recovery. Simply go to stemcellsphiladelphia.com for a free evaluation or call today at 610-352-1710.
Ladies and gentlemen, welcome back. I'm your host, Maurice Goodman, and this is the Ask the Experts radio show. And today we are with Dr. Michael Skeena and Dr. Gerard Teller of the Art of Pain Management and Regenerative Medicine in Philadelphia. They today are talking about stem cell and pain management, and they are the best at this in the business in this region. And you've been listening to some of the ways that they get about dealing with stem cell therapy and pain management, and we really are now very, very privileged to have you on because this is very exciting stuff. Talk to us about what your doctor's experiences are with pain management, and then what kind of patients seek out stem cell treatments.
So over the last 10 years, Dr. Skeena has done over 25,000 injections, combination of spine, knees, hips, and shoulders. I have done 25,000 exams and education of all those patients that he did injections with. So we make a nice team. We have seen mostly conditions associated with herniated discs, sciatica, meniscal tears, rotator cuff tears, major spine surgeries, fusions, pedicle screws and rods. Wow. And we've been dealing with this type of chronic pain for 10 years now. And with the stem cells, as Dr. Skeena alluded to earlier, we finally see some of these patients getting more than a couple months relief from our injections. They're actually getting tissue regrowth, tears that are healing, pain relief now that we've seen over a 2-year period, as opposed with traditional cortico injection steroids and medicines that we've been using. Maybe they get anywhere from a couple weeks to a couple months. Now we're seeing more long-standing results. People always ask us, how long is the stem cell going to last for? And we don't know. In the United States, we've only been utilizing it for maybe 2 years now. In places like Germany and Panama City, they've been using it for up to 10 years. So there are some 10-year studies out there, but in the United States and experience in our office, we only know that we have, clinically documented 2 really good years of these people's pain relief and, tears that are healing, meniscuses that are growing back, discs that are reinflating.
What has been mostly the individual that walks through the door? Is it an athlete? Is it someone that's working on construction, road work? What are the types of individuals that you've seen the most come through your doors?
I think all of the above. The patients that come to see us for stem cell therapy are those that are either active but not as active as they want to be, or those that have lost their mobility and want it back. A lot of these patients have high pain threshold and insist on being active in spite of their pain. They're very, very anxious to get their lives back, and stem cells and the exosome therapy has given them that opportunity.
So so I come through the door and you see the need, you then prescribe the treatment. The treatment is done. Are there side effects with the treatment, with stem cells and the therapy? Are there side effects?
The side effects from therapy are minimal to none. With the use of stem cells, there's a preservative that's used. The cells are cryogenically frozen and preserved. There's a preservative that's used that less than 2% of people will react to. The reaction is usually nothing more than a local skin reaction, some redness and irritation at the injection site. Most patients will have no reaction whatsoever. With exosomes, there are no preservatives used, and we generally don't see any reactions from the exosomes as well. And getting back to stem cells, with injection of stem cells, there's a very low incidence, less than 1% of fever. It's a low-grade fever, which can go on for the course of a couple of days, that's easily treated with Tylenol. So we really haven't seen any significant side effects at all.
Mm-hmm. Speak to us. You spoke a bit about the conditions by which you treat stem cells and treat with stem cells, dealing with pain management as well. Are there other aspects of pain management that go in parallel with stem cell therapy? Are there other types of pain management treatments that you do as well?
Yeah. So anyone with headaches, osteoarthritis, neck pain, arm pain, neuropathies in their arms or legs, disc disease, tears, tendon tears, sports injuries, tendinitises, bursitis, all of these things can be helped in our office with a wide variety of things. I mean, sometimes people come in and they're all set on getting stem cells, but they only might need ozone. They only might need an ozone injection, which is very, very affordable. And they're happy as could be. They thought they were coming in and, getting stem cells. But so it just all depends upon the condition, their age, and what's wrong with them.
Does insurance cover your treatment in the office?
So unfortunately, we take all insurances in our office for traditional interventional pain management. That would be, epidurals, nerve ablations, cortisone injections, hyaluronic acids like Synvisc and Suparts, but the stem cells are not covered. The stem cells you would have to pay out of pocket. Yes.
So that's a key thing. So when people do come in with that type of treatment, they do have that. Speak to us about the different types of treatments. You were speaking about one or two of them. What are some of the specialties that separate you from other treatment organizations that people would watch and look you up?
So we're looking at the body as a whole. We're looking at your diet. We're looking at what vitamins and minerals you're taking. We're looking at your blood work. We're looking at if you're a smoker, if you drink a lot of alcohol. We're looking at how heavy you are, what activities you're doing, what your job is. Maybe this repetitive motion is causing these problems. There's certain ways to rehabilitate yourself. There's certain ways to meditate, certain things like headaches. Swimming programs are wonderful. All the injections. There's very few injections we don't do in the office, and we have to take you as an individual and make a care plan.
We also look at the medications that you're on. Some common medications will interfere with the function of stem cells, namely nonsteroidal anti-inflammatory drugs like Motrin, ibuprofen, Aleve, naproxen. There are others in the same category. There are some patients who are on immunosuppressants for various diseases like rheumatoid arthritis or inflammatory bowel disease. Those medications can negatively impact the function of stem cells. So it would be desirable to have someone who's not on those medications for the stem cells to work well.
Very good. Appreciate that. What we're going to do now is we're going to take a quick break. Listen, ladies and gentlemen, you're listening to Dr. Michael Skeena and Dr. Gerard Teller of the Art of Pain Management and Regenerative Medicine here on the Ask the Experts radio show here on live on 610 a.m. in Philadelphia.
Stop dealing with chronic pain and illness of the neck, low back, shoulders, hips, or knees in the Philadelphia area. Would you like to get your life back? At the Art of Pain Management and Regenerative Medicine, the doctors will work with your body to help relieve pain in your muscles and joints so that you can increase your mobility, sleep better, and enjoy your days more. They work by using a variety of invasive and non-invasive treatments and techniques to help manage pain and chronic illness. Tradition, Western medicine, as well as yoga, diet, nutrition, weight loss, and stem cells are implemented to customize your recovery from chronic illness. At the Art of Pain Management and Regenerative Medicine, their aim is to personalize each plan to best serve their clients' needs. This individualized care is backed up by more than 50 years of combined experience and individualized attention at each appointment. If you are near Philadelphia or Upper Darby, Pennsylvania, the offices of the Art of Pain Management and Regenerative Medicine may be your key to health and recovery. Simply go to stemcellsphiladelphia.com for a free evaluation or call today at 610-352-1710.
And ladies and gentlemen, we're back. I'm your host, Maurice Goodman, and you're listening to the Ask the Experts radio show live on 610 a.m. ESPN in Philadelphia. We are speaking with Dr. Gerard Teller and Dr. Michael Skeena of the Art of Pain Management and Regenerative Medicine, based here in Upper Darby and in the Philadelphia area. They're specialists in stem cell therapy and pain management. And we have a few more minutes left, but what we certainly did want to do is, as we talked about insurance, we also want to talk a little bit about FDA regulations. What's the state of play with the Food and Drug Administration and what you're doing in this space?
Sure. The FDA has approved the use of stem cells for bone marrow transplantation in patients who have undergone chemotherapy for blood-borne cancers, primarily leukemia. They have not approved the use of stem cells for any other indication. So currently, the use of stem cells to treat osteoarthritis and other diseases is considered experimental by the FDA. That said, one of the advantages of using exosomes, these are the vesicles that contain the chemicals that the stem cells release, is that they're actually governed by Section 351 of Title 21 of the FDA, of the Federal Code of Regulations. Title 21 is the regulatory guidelines that pertains to use of human and tissue cells. Primarily because there's no nuclear contents, that is, there's no DNA, no genetic material in the exosomes, they're regulated by Section 351, and by such, they do not require FDA approval.
Okay.
So the use of exosomes is perfectly legal by way of FDA regulations.
And Dr. Skeena, I would imagine that's a very key piece in your practice, is to be sure that you're following the guidelines and that the ethics are there. So know that listening audience always wants to know that the management of their bodies is ethical and sure to and down the line, and you follow those lines.
Correct. We absolutely do. So I want to stress that even though we are following FDA guidelines, we are in compliance with the regulations. The use of stem cells to treat arthritis and other conditions is still considered experimental.
Mm-hmm. Appreciate that. How do you stay abreast of the newest technology, and are there continuing education courses out there? I guess Dr. Skeena, sure.
Sure. There's very little to no education in medical school on regenerative medicine. At the current time, the best way to stay abreast of the latest developments is to attend conferences. Some of them are international, where leading experts in the field are giving presentations on the latest developments. And actually, I personally have been to, I guess it's about 3 of those in the last 6 to 9 months. And I'll be attending another one of those conferences in March. So I try to attend as many as I can. There's certainly a limit to how much I can be out of town, but at the present time, that's the best way of staying abreast of the latest developments. It's by the time a textbook is printed, the information is 2 to 3 years old.
Wow.
And in the field of regenerative medicine and stem cell therapy, that's markedly outdated.
Wow. How about that? And Dr. Jarrett, any thoughts on your end?
No, just the we meet with the brightest minds in the world on regenerative medicine and stem cells maybe once a quarter now, and we realized from listening to all these experts speak and going to dinner and lunches and group chats and communications with all these doctors from around the world, actually Germany, Spain, Panama City. We realize now that we've done as many procedures as some of these experts. So now at these conferences, they're sitting down with us and wanting to pick our brain and how we're doing it and looking at our data. So slowly, as time has gone on over the last couple of years, we have been becoming the experts at these conferences.
And that's why you're on the Ask the Expert show.
There we go.
The thought leaders in stem cell therapy and pain management. Gentlemen, please let our listening audience know how they can get in touch with you and reach out to your offices.
We have a website, it's stemcellsphiladelphia.com, stem cells with an S, Philadelphia.com. 610-352-1710 is our call center. And we offer free consultations in our office. We have once a month a free educational event somewhere around the city, usually at a hotel or a restaurant. And all we want to do is educate. When you call the office, our director of marketing, Jerry Penders, will be giving you a call back, and you can have unlimited time with him on the phone asking questions. You could have unlimited time with us when you come in for a consultation at our office, which is absolutely free for stem cells. And we're looking forward to seeing everybody.
Gentlemen, thank you for that. Ladies and gentlemen, you've been listening to Dr. Jared Teller and Dr. Michael Skina of the Art of Pain Management and Regenerative Medicine in Philadelphia and Upper Darby. I see that we have to conclude for today. Please just thank you very much for the time with the listening audience.